Welcome back to the third segment of Normal Growth, Development and Puberty in Children and Adolescents lecture. I'm Dr. Amel Elfaramawy, Professor of Pediatrics. In the previous segment, we started assessment of growth using anthropometric measurements. I explained to you measurements of the weight, height, body proportions, growth velocity, and body mass index calculation. Now I'd like to move to the next very important item in growth assessment, which is the measurement of skull circumference. Serial measurements of head circumference are crucial during infancy, as it is a period of rapid brain growth. The brain attains about 75% of its adult size by the end of the second year. Just plot the measure on the chart matched for age and sex to check if it is within normal range or not. For example, if a girl 6-month-old has a skull circumference of 42 centimeters, this will be on the 50th centile, which is normal for age. You have to know that at birth, the mean skull circumference is 35 centimeters. The skull grows by 2 centimeters per month for the first 3 months, then 1 centimeter per month for the second 3 months, then 0.5 centimeter per month from 6 to 12 months of age to reach 47 at the age of 1 year. So the skull increases 12 centimeters in the first year of life, and this is the maximum growth of the skull, and it reflects the maximum growth of the brain that occurs in the first year of life. By the end of the second year, it is 49 centimeters, and by the end of the third year, the skull will be 50 centimeters. Then the skull growth slows down to reach the adult size by the age of 5 to 10 years. The skull grows owing to the open sutures and fontanelles, which are gaps created when cranial bones are opposed. 6 fontanelles are present, but only 2 are of clinical importance. The posterior fontanelle, which is the gap between the sagittal and lambdoid sutures at the meeting of parietal bones and occipital bone. It is 0.5 centimeter, closed shortly after birth. The anterior fontanelle, which is the gap between coronal, sagittal, and metopic sutures at the meeting of parietal bones and frontal bones. It is 2 centimeters at birth, enlarges over the first few weeks to be 4 to 5 centimeters, gradually decrease in size to close at the mean age of 13.8 months. Skin fold thickness is measured using hair-pendant skin fold caliper that you can see in this image. A thickness of a fold of skin and subcutaneous fat could be measured at the triceps, subscapular, or suprailiac areas. Triceps skin fold thickness is used along with the mid-upper arm circumference, measured midway between the olecranon process and acromion process, to calculate the mid-arm muscle circumference using this formula. This is important in assessment of children with protein energy malnutrition in which there is reduction in the muscle bulk. As regards teething, primary milk teeth usually start eruption at the age of 6 months. They usually start to erupt in the lower jaw by the eruption of the lower central incisors, and then the next follow in the order that you can see in the image. They usually erupt in pairs. The two similar erupt at the same time. They are usually smaller and whiter than the permanent teeth. The total number of milk teeth is 20. They complete eruption by the age of 2 to 3 years. There are 32 permanent teeth that also start eruption in the lower jaw at the age of 6 years. There is a period of overlap between the age of 6 and 12 years. A mixture of primary and permanent teeth are there in the mouth. 4 wisdom teeth erupt at the age of 21 years. Usually there is a normal wide range of variation in eruption and shedding of the teeth. The last item in growth assessment is assessment of bone age, which utilizes the recognition of changes in the radiographic appearance of indicators of bone maturity in the form of ossific centers and the size and articulation of the bones. The classical method to determine bone age is by doing X-ray of the left hand and to compare with the reference atlas or digital hand atlas. A rough technique is to count the carpal bones in the X-ray of the left hand as you see here in the image. There are 8 carpal bones. The first 2 appear in the first year, then 1 yearly afterward in anti-clockwise order. For example, at the age of 1 year, there are 2 carpal bones. There are 3 carpal bones at the age of 2 years, and there are 4 carpal bones at the age of 3 years. Bone age should be equal to chronological age. Any discrepancy, whether advanced or delayed bone age, should be explained. Now you have to be aware of the red flags or alarming signs in growth monitoring, which are a weight or length or head circumference that are below the 5th percentile or more than the 95th percentile. This means that both extremes of any parameter are abnormal and warrant investigations. If you find discrepant percentiles, for example, if the weight and height are on the 5th centile but the skull circumference is on the 95th centile, this needs explanation. The third point is that if during growth monitoring you noticed large shifts of percentiles, this also warrants attention, whether declining percentiles or increasing. For example, if the skull circumference was on the 10th centile, then with monitoring it is on the 95th centile over 1 month. This needs investigation. Well, that's all for growth assessment. We have discussed growth monitoring using anthropometric measurements, teething, and bone age. Next, we will discuss development. Do you remember how we define development? Let's see in the next segment.